Hey guys, please watch my video till end because the quality content which I will provide you in or less than 3 minutes will be priceless and very useful to you. It might change your life, so I don't think you will skip my video. So let's start the powerful video. Most people don't like to talk about it, but more people than you think have stomach problems. Before starting the video, please do not forget to like, share, subscribe and press the bell icon for new interesting videos. In fact, the National Institute of Diabetes and Stomach and Kidney Diseases, NIDDK, says that between 60 and 70 million people have some kind of stomach disease. If you think you have one of these problems, you should talk to your doctor right away. 1. GERD, or Gastroesophageal Reflux Disease. Acid reflux is when stomach acid goes back up into your esophagus. This can cause a burning pain in the middle of your chest. Acid reflux and heartburn are common. But if you have symptoms that affect your daily life or happen at least twice a week, it could be a sign of GERD, a chronic gut condition that affects 20% of Americans. See your doctor if you have chronic heartburn, bad breath, tooth erosion for no clear reason, nausea, pain in your chest or upper abdomen, trouble swallowing or breathing, or if you have trouble breathing or swallowing. Most people feel better when they avoid foods and drinks that make their symptoms worse, or when they take over-the-counter antacids or other medicines that stop the stomach from making acid and lower inflammation in the esophagus. Changes in lifestyle, like raising the head of the bed, not sitting down after eating, and giving up smoking, can also help. But some people with GERD need stronger treatments, like drugs that stop acid from making the stomach hurt or even surgery. 2. Stones in the gallbladder. Gallstones are hard masses that form in your gallbladder, which is a small, pear-shaped sac that stores and releases bile to help digestion. The American Gastroenterological Association says that nearly 1 million Americans get gallstones every year. Gallstones can happen when the substances that make up bile, usually cholesterol or a waste product called bilirubin, become too concentrated and form a hard stone. When gallstones get in the way of the tubes that connect your gallbladder to your intestines, they can cause sharp pain in the upper right part of your belly. Usually, surgery to remove the liver is the next step. 3. Celiac disease and not being able to eat gluten. Beyond Celiac, which used to be called the National Foundation for Celiac Awareness, says that celiac disease affects about 1 in 133 Americans, or about 1% of the population. Beyond Celiac also says that 83% of people with celiac disease either don't know they have it or were given the wrong diagnosis. Celiac disease is an immune response to gluten, a protein found in wheat, rye, and barley. When you eat gluten, your immune system goes on the attack. It hurts your villi, which are the finger-like projections in your small intestines that help you receive nutrients from the food you eat. Symptoms in children can include pain and swelling in the stomach, diarrhea, constipation, vomiting, and weight loss. Anemia, tiredness, bone loss, depression, and seizures can also happen in adults. The only way to treat celiac disease is to never eat gluten again. Brown rice, quinoa, lentils, soy flour, corn flour and amaranth are all good gluten-free options. Some people may not have celiac disease but still have a problem with gluten. This is called a sensitivity to gluten. Gluten intolerance can have some of the same signs as celiac disease, but it is a digestive disorder, not an immune disorder, so it doesn't hurt the intestine or cause problems like anemia or bone loss. Also, people who can't handle gluten can eat it if they are willing to deal with stomach problems. 4. The disease Crohn's. Inflammatory bowel disease, IBD, is a group of digestive illnesses that includes Crohn's disease. Crohn's can affect any part of the GI system, but it most often affects the terminal ileum and large intestine, which connect the end of the small bowel to the beginning of the large intestine, or colon. The NIDDK says that more than 500,000 people in the United States have Crohn's disease. 5. Crohn's disease. The NIDDK says that ulcerative colitis, which is also an inflammatory bowel disease, may affect as many as 900,000 Americans. The signs and symptoms of ulcerative colitis are similar to those of Crohn's, but only the colon is affected. If your immune system mistakes the lining of your colon or other parts of your body for attackers, sores or ulcers can form in the lining of your colon. See your doctor if you have to go to the toilet often and quickly. If you have pain with diarrhea, blood in your stool, or if you have cramps in your stomach. The inflammation can be stopped with medicine, and avoiding things that hurt may also help. In serious cases of ulcerative colitis, the colon may need to be taken out through surgery. 6. Syndrome of irritable bowel. Is it hard for you to digest? Do you feel pain or soreness in your stomach at least 3 times a month for a few months? It could be IBS, which means Irritable Bowel Syndrome. The International Foundation for Functional Gastrointestinal Disorders says that between 5 and 10% of people have IBS, and that up to 45 million of those people live in the United States. Having hard, dry stools, soft, watery stools, or both can be signs of IBS. IBS can also cause swelling and gas. No one knows what causes IBS, but a high-fiber, low-fat diet and avoiding typical trigger foods like dairy, alcohol, caffeine, artificial sweeteners, and foods that make gas are good ways to treat the symptoms. 7. Bleeding gums. If you go to the bathroom and see bright red blood in the toilet bowl, you might have hemorrhoids. In fact, the NIDDK says that 75% of Americans over the age of 45 have hemorrhoids. Hemorrhoids are painful and itchy swollen veins in your anus or lower rectum. Some of the things that can cause this are severe constipation, diarrhea, straining during bowel movements, and not eating enough fiber. Eat more fiber, drink more water, and exercise to get rid of hemorrhoids. Most of the time, you can treat hemorrhoids at home with creams and pills that you can buy over the counter. But if the symptoms don't go away, doctors may prescribe medicine or do a medical treatment like a hemorrhoidectomy to remove the hemorrhoids. 8. Diverticulitis. Diverticula are small pouches that can form anywhere in your digestive system where there are weak spots in the lining. However, they are most often found in the colon. Diverticulosis is a common condition in older people that rarely causes trouble if you have diverticula but no symptoms. The American Gastroenterological Association says that by the time a person is 50, about half of them have diverticulosis. But about 5% of people get a condition called diverticulitis, which makes the pouches swell up or get sick. There may be a fever, chills, sickness, and pain in the stomach. Diverticulitis is more likely to happen if you are overweight. So that your gut can heal, a clear liquid diet is used to treat mild diverticulitis. In the past, antibiotics were the first treatment for uncomplicated diverticulitis. However, new rules from the American College of Physicians say that most cases can be treated without antibiotics. Diverticulitis could be caused by a diet low in fiber, so your doctor may tell you to eat more whole grains, beans, and veggies as part of your treatment plan. According to the Mayo Clinic, complicated cases of diverticulitis are generally treated with antibiotics given through a vein and may need surgery. 9. Anal crack. Anal fissures are small tears in the walls of the anus that are oval in shape. Some of the symptoms are like those of hemorrhoids, like blood and pain after going to the toilet. Straining and having hard stools can cause fissures, but so can diarrhea and loose stools. Stat Pearls says that about 250,000 anal cracks are found every year in the United States. Most of the time, the best treatment is a diet high in fiber that makes your stools solid and thick. Pain can be relieved with topical anesthetics, sitz baths, and medicines that relax the muscles of the anal sphincter. However, if the cracks don't heal, the anal sphincter muscle may need to be operated on. If your attacks are serious and keep coming back, you may need surgery to take out the diseased part of your colon. Like, share, subscribe and comment.